Hi, I'm Anne-Marie Harrison from Ideas Afresh Education Limited, and I'm pleased to be talking to you today just briefly about ODD. And by definition, the defiant and disorder that really means is about behaviours that we see in children that are persistently present for 6 months or more. And those behaviours might be persistent irritability, persistent defiance, persistent destructiveness, some really disturbing and unhappy signals that we're getting from our children. And of course, these disorders, along with other diagnoses, can run alongside many of the neurodevelopmental topics that we do talk about. But in order for DSM-5, the diagnostic manual, and ICD-11 to diagnose for this particular oppositional defiance disorder, then that is very much about looking at the persistence and the relevance and the continuity of those behaviours. But the good news is that actually with the right support and the right input, that we can help with those changes in behaviour and identifying where that reluctance is coming from, which is often rooted in fear and anxiety, or maybe based in trauma and experiences, life experiences. Many of those experiences, people talk about there's definitely a chance to change them. And when we can work and support our children in the right way, then that can be really helpful on that journey of improvement. And in fact, there's some research that was done that suggests that after 3 years of appropriate support, then we can see a significant change in those behaviours and in that presentation. And Dana Abraham, in this book, Calm the Chaos, she really talks about the most challenging kids. And within that, she talks about those ODD children and many of the profiles that they present with. And she's a real advocate of the kinds of strategies that I like to put in place, even for our neurodevelopmental families, and how they are working with and supporting their children. And one of the things that I had a lot of success with was mealtime chaos for some families, where families were complaining that children were overtaking the conversation at the table or not letting siblings take a turn. So we just made this little, again, based on our children's interests. So this was from Minecraft. So everyone got 3 pieces of TNT dynamite, and then they were able to pay in turn with those. So they were like cashed in during the family meal so that everyone got chance to speak and have a turn at contributing at the table, rather than having this very disruptive, very resentful sort of behaviour that was going on previously. So I think the key message here is that if our children are presenting with ODD, that actually there is a lot we can do to support them, and a lot we can do that we know will make a difference in moving forwards.